Hi, my name is Kirsten Lamb, and this is my personal healthcare and nursing ethics video for Nursing 564, Contemporary Healthcare Environment at Gonzaga University. So I'd like to begin with the question, what is ethics? According to the Marcula Center for Applied Ethics at Santa Clara University, ethics is two things. First, ethics is well-founded standards of right and wrong that prescribe what humans ought to do, usually in terms of rights, obligations, benefits to society, fairness, or specific virtues. And then second is the study and development of one's ethical standards. And they explain that this is different from feelings, religions, following the law, or following what society accepts. For me, my personal ethics are centered around the principles of respect and honesty. According to the American Nurses Association, the nurse is committed to respect the dignity of each patient and to foster each patient's freedom to make choices to receive that to which he or she is entitled. Respect for the patient and the primacy of the patient's interests is the basis for this commitment. Although it's not always easy, the nurse has a duty to respect our patients and the decisions that they make, and to honestly provide them with information that allows them to make informed decisions. I feel like if I apply the principles of respect and honesty to the practice of nursing, I am also able to act in accordance with other ethical principles that guide the practice of nursing, including autonomy, freedom, beneficence, non-malfeasance, veracity, confidentiality and privacy, fidelity, and justice. I've included a quote which states the character of the nurse is as important as the knowledge that she, or I would add he, possesses. I believe that those who choose to practice in healthcare have an obligation to act ethically, both professionally and personally. I think that our personal conduct as nurses should represent our respect for the dignity of each patient. And I think one example of a place where I think it's easy to make statements personally that really aren't in alignment with our profession of nursing is through maybe social media or personal blogs. So I think, for instance, it's really easy for all of us to say it's not acceptable for a nurse to share private patient information. But something that I've seen is maybe a nurse making a personal comment, posting something that I think was intended to be humorous, but came across really derogatory against a group of patients, and that was those patients that received government assistance. And I think it was intended as her personal belief, but then when you take that and say that she is also stating that she's a nurse, then I think that really it is in alignment with our ethical obligation as a nurse to respect the dignity of our patients. So I've included some information from the American Nurses Association Code of Ethics that I think really aligns with my personal view of nursing ethics. So first, the nursing profession holds that health is a universal human right. This right has economic, political, social, and cultural dimensions, and nurses must address the context of health, including social determinants of health such as poverty, access to clean water and air, sanitation, human rights violations, hunger, nutritionally sound food, education, safe medications, and healthcare disparities. And so, like I said, I believe that nursing has an ethical responsibility to support the health of our patients and recognize that their health occurs in a much larger context. Therefore, as nurses, something like advocating for education reform or improvement may not seem like something that would be part of our duty as nurses, but I think if we consider that maybe those patients who have more education have greater health, then it really we can see how the decisions that we make in a larger context impact the health of our patients. The final quote that I've included from the American Nurses Association Code of Ethics states, "As nursing seeks to promote and restore health, prevent illness and injury, and alleviate pain and suffering, it does so within the holistic context of healing the world." And I think really when I look at my personal view of ethics in nursing, it's that it is holistic. and that nurses have a responsibility and obligation to advocate not only for the rights and health of our individual patients, but our communities and larger populations and the greater social, political, cultural, and economic context in which health occurs. Thank you for listening.